Matthew Show from the Citizens Bank studio. Appreciate you joining us today. I really enjoyed that conversation. Now we're going to move to Singing River Health Talk, a really cool weekly thing that we're doing now. Get to talk to so many wonderful professionals. Today we have another really cool doctor that we get an opportunity to get to know. His name is Dr. Rishi Roy, and he specializes in diagnosing and treating conditions affecting arteries and veins. And we'll get into where he's practicing at Singing River these days. It's actually at the new Singing River Cardiology Center in Pascagoula, but we'll hear more about that here. Let's go ahead and bring Dr. Roy into the conversation. And first of all, just say, how you doing, my friend?
I'm doing well. What can I complain about? I'm here on the Mississippi coast, enjoying the weather, getting to do some fishing, and most importantly, helping patients.
Yeah, well, I can see that. I was really impressed with your background. First of all, you went to the University of Virginia, and you went to medical school at University of Mississippi Medical School, and then we'll talk a little bit more about what you did after that. But what's notable is in your residency, you are a leader, Dr. Roy. I mean, you were involved in being a leader throughout your class, won multiple awards. Have you always been a leader?
I'd say I came into it maybe end of high school and then especially in college. It's one of those things that I don't necessarily strive for. It's just something that, I end up trying to do the right thing and lead by example. And it's always one of those situations I've thought about, and that you want to be a leader that people want to follow and not have to follow. And that's always been one of my philosophies in how I, set myself up for my professional career and practice, et cetera.
Yeah, we'll actually get into some of the stuff that you do outside of work, which is, again, it's a lot like being a leader in just about every aspect of your life. You are practicing at the Vascular Care at the Singing River Center for Cardiovascular Surgery, which is actually located at the new Singing River Cardiology Center in Pascagoula. You were practicing in Jackson before this. You excited to be on the Mississippi Gulf Coast?
I can't tell you how excited I am. It's I should have moved down here earlier, but it's so great. It's so much fun. Everyone's been unbelievably nice and helpful. You're talking about from people who helped connect me to the internet at my house, to the gas company, to the electricians and everybody. I mean, they go above and beyond, and it's certainly something that's kind of a hidden gem. I don't think people know about it, and it's
yes. Great. Tell me about your practice. Tell me in your specialty.
So I specialize in vascular surgery. So the way I kind of explain that is I'm just a real fancy plumber. I deal with arteries and veins everywhere except for the heart and inside the cranial cavity, meaning the brain. So from venous disease, varicosities, venous reflux, where you get swelling in the legs, spider veins, deal with that stuff, to blocked arteries in the legs, aneurysms in the abdomen of the abdominal aorta, to disease in the arteries that supply the brain. These arteries are in the neck. If they get diseased, they can cause stroke. So we do it all. The big idea, especially the big push for me down here, in which Singing River brought me down to do, is what we call limb salvage. And that's to help prevent amputations. When I talk to other physicians and primary care providers, being nurse practitioners and PAs, the big thing that I really strive to show them is why limb salvage and amputation prevention is so very important. In the state of Mississippi, we got a very high rate of diabetes, we got a high rate of obesity, and we've got a high rate of smoking. All three things contribute to cardiovascular disease. There's a lot of information out there about coronary disease, what affects the heart and the vessels that supply the heart muscle. There's not as much information about peripheral vascular disease, i.e. the arteries that affect the legs. And if we all know about cancer staging, there's 4 stages: stage 1, 2, 3, 4, right? The oncologist did a great job of staging cancer easily so that people understand it. Even patients can understand it, right? We as vascular surgeons have not done such a good job in doing that, to understand how bad, blood flow is to the legs. And if we look at major amputation, meaning toes or foot or leg, and survivable rate at 5 years, and then we look at stage 4 cancers, there's only 3 cancers that have a worse survivability than major amputation: So if you have stage 4 colon cancer, you have a better chance of survival at 5 years than you do with a major amputation. We need to change that.
Wow. That's incredible. I have a cousin who's had he had pretty significant issues, had diabetes as well. And at UAB, where he is treated, they have fought and fought and fought over many, many years just to save his limbs. And unfortunately, recently had to have his leg amputated below the knee. It was a tough decision, partly due to himself, because, listen, he has a farm. He's out working on that farm, and he'll get, because of his neuropathy, he would get a sore or something on the bottom of his foot and not pay attention to it. You've seen this over and over again, where it becomes a problem that you just can't seem to get healed. But you specialize in trying to get the blood flow down there so that you can get, wounds like that fixed as quickly as possible. It's just a tough scenario, isn't it?
It is. And part of it's some education, part of it's, good and access to healthcare, right? And that's what we lack in this state is easy access to healthcare. And so that's, one of the reasons why I really sought out this opportunity down in this community to try to see if I can help and make a difference.
You know what I've noticed, and it's literally been a theme throughout all of these conversations in colon cancer and whether it's women's or men's health, a wide range of conversations that I've had. When you consider that 51% of Mississippians live in rural areas, I mean, they just, you think about culture and the way they eat. You mentioned smoking. We probably are not paying as close attention to our health as we need to. But the impact on cardiovascular disease, specifically in the areas that you are responsible for, it can be, these things add up and can be devastating, and people can literally change their lives and have a positive impact on the kind of vascular diseases that you're dealing with, can't they?
They can, yeah. I mean, we call it lifestyle modification, right? I'm not saying that you can't go out and eat fried catfish or fried chicken. And trust me, I get over to New Orleans a good bit. I love food. I'm a huge foodie, but it's all in moderation, right? And that's the key is, you got to balance it out with the good. And so that's what we advocate. I mean, when I talk to patients about smoking, I'm quite a direct person about smoking. I tell them very simply, look, it's an adult decision. You're making the decision to smoke. You're also then making the decision to increase your risk of amputation. And there's a very high likelihood that at some point, you and I are going to have a very difficult conversation about you needing an amputation.
I have a friend of mine who had some stents put in, and he smoked, and he stopped smoking for a period of time, started feeling good again, started smoking again. And I said, buddy, listen, when you smoke, you constrict your vein, I guess your veins and arteries when you smoke. Is that essentially it? So if you have an occlusion or some issue, it could cause stroke. There are a lot of issues that could happen. I'm begging him to stop smoking.
So the thing about smoking is, it affects the arteries and it affects the increased amount of plaque buildup. That's the blockages that we talk about, plaque. But the other thing that smoking does is there's a kind of a protein or enzyme that the body makes that's a growth factor. And so this is how athletes, when you think about athletes in training, they train until they start feeling pain and they build up lactic acid in their muscles. That then signals their body to grow more blood vessels so they can get more blood flow down there, because then oxygen, and they're able to create energy to keep training. And so that's why training works. So you look at cross country runners and other athletes who, at first they're able to do a mile and then a mile and a half, then 2 miles, et cetera, right? Because we're building more blood flow to the muscles that need the blood. Your body is a remarkable thing. It really can adapt to so much. Well, the smoking and the different additives that are in the cigarettes block that growth factor. So as your body is shutting down a particular artery, your body is actually able to build new blood vessels to help blood flow around that blockage. Well, this is preventing your body from doing that. And then that's what causes the major event of when there's an abrupt stop of blood flow. You then no longer have blood flow to the muscle that needs it, whether it's the heart or whether it's down in your legs. And you have what's called ischemia, or lack of oxygen, to maintain that tissue's viability. And so then you get into tissue death.
It sounds to me like when you get a positive outcome, when you get a patient that works with you and you do the things that you need to do as a doctor, if it involves surgery or whatever, and they have a good outcome. It seems to me that you're the kind of guy who really is proud of that parent, of that patient.
It's life changing, right? And I mean, these people are able to, play with their grandchildren and go out and play golf again, and get on the boat, go to the islands, do what they want to do, right? I mean, I do the surgeries in order to help these people live the lives they want to live, and that's super important, and that's why we do this. I mean, I understand it's not fun coming to a doctor's office, and it's not fun coming to the hospital because 90% of the time you're getting bad news. You're getting news that you need something done, you need some surgery, it has risk, it has issues. And so, yeah.
Yeah. So what we'll do when we come back on the other side, I want to talk about where Dr. Rishi Roy came from. How did he pick the University of Virginia to go to school? How did he pick coming to medical school here in Mississippi? And he's written extensively, including about, let's see, it'll come back to me. Aneurysms, of course. That's for sure what you've written about. When we come back, we'll continue our conversation with Dr. Rishi Roy. We'll see you after this break. Welcome back to the Ricky Matthews Show from the Citizens Bank Studio. We're visiting with Dr. Rishi Roy, who is a native Mississippian, I learned during the break. He went to school at the University of Virginia and then back to University Medical Center, Ole Miss Medical School for medical school. And he is a vascular surgeon, among other things. And he really seems incredibly committed to helping people have great outcomes. You can tell it. So how did you pick the University of Virginia to go to school?
Well, I knew I always wanted to do medical school. I was also interested in American government, and I thought, what better place than there? So I ended up going to University of Virginia. I did a degree in government with a focus in American government. Was able to spend some time with Professor Sabato. He does he's a political pundit, often on Fox and other areas, talking about elections and stuff, which was actually kind of a focus of mine. And it was just a wonderful place to go to school, and had the privilege of getting a diploma.
Yeah, well, while we're on it, we'll go ahead and mention it. I mean, Charlottesville, what a great place to learn about democracy, given Thomas Jefferson's impact and Monticello being there, which I've had the opportunity to go there myself. But you actually co-founded an organization called Mississippi and Youth Government. It's a nonprofit. You really put your energy where your mouth is when you talk about democracy, don't you?
I certainly am passionate about it. I mean, the key for me is that having especially the younger generations learn what democracy actually is, and then how the government works, and how laws come to be, and what an impact we can have as citizens on what we truly believe in shaping the future for our country.
You're also, the Mississippi Museum of Art, the Mississippi Symphony Orchestra, the youth legislative program. I learned during the break that you grew up playing piano and you also played trumpet. So you're kind of a jack of all trades. It's great to feel culture in your life, isn't it?
It is, and I always heard people complain when they moved here and moved away that there just wasn't anything to do. And there was a lack of culture and lack of art and there's no such thing. I mean, birthplace of America's music. You can see art all around us. It's an amazing, amazing place to be.
I'm reminded I was in the Mississippi Delta this past weekend, and with the Blues Trail, which I talk about often on this show and my outdoor show that I have on Mondays, that the influence of Mississippi, when you're in the Mississippi Delta and you see it for yourself and you talk to people, you pass the signs that immortalize essentially Robert Johnson, and you see so much that's happening in the Delta as it relates to blues. I mean, it's a special place. And, I often say this, when people leave Mississippi, like yourself and myself in my career, having the opportunity to leave here, we carry with us a burden. And the burden is to dispel the myths about Mississippi, because there's what people think of us and what really exists here are two totally different things. And I love that, taking on that burden and carrying that responsibility. You sound like the kind of guy that does that as well.
Oh, most certainly. I mean, I had the privilege of going to UVA twice, right? I mean, I went as undergrad and then went back for kind of bookended my career there. But it was great to go there. I mean, it was kind of funny. I was going to that hospital thinking, okay, this is going to be, it's a top 10 vascular program, one of the best hospitals in the country. It was very similar to Mississippi, demographics wise, as far as patients go, et cetera. And it was really cool to get there and have people look at me and say, wow, you were really well trained going to the general surgery program at Ole Miss and doing medical school there. And so it's fun to dispel people's myths about what they think about Mississippi and what, quote unquote, whether we are advanced or not here, et cetera. I mean, the first heart transplant was done by Dr. Hardy at the medical center in Jackson. I think Dr. Raju, if I have it correct, did the first heart lung transplant, the tandem transplant. So there's been breakthroughs that have been done here. They'll continue to be done here. I mean, you talk about Emmy Award winners, Grammy Award winners. You talk about Nobel laureates. I mean, and just sports left and right. So.
Yeah, it's very significant. Listen, it's been a pleasure to do the Singing River Health Talk every week, to have the opportunity to talk to people like you. And I haven't talked to anyone yet that wasn't incredibly communicative, a really good, one of the keys to being a great doctor is being able to talk to people and communicate with them and care about them, have empathy for them. But then you bring great skill set to the table. The advancements in technology, the investments in technology at Singing River have been tremendous. But Dr. Roy, just so you know, offers high quality vascular care at the Singing River Center for Cardiovascular Surgery, and that's located within the new Singing River Cardiology Center in Pascagoula. And you're lucky to be a part of that team, man. This is a terrific medical center. I really appreciate you joining me today. You're a very impressive man.
Oh, thank you so much for having me on. I truly appreciate it.
It's been great. This has been Dr. Rishi Roy, vascular surgeon from Singing River Health System, today on Singing River Health Talk. Listen, have a great day, and we will see you tomorrow.